Right now, the federal government and your state government are sitting on a combined list of programs, services, and benefits that are available to you completely free of charge. Not discounted, not reduced, free. Prescription medications, in-home care, legal help, dental work, home repairs, food, transportation to your doctor's appointments, tax preparation, emergency monitoring systems. Every single one of those things has a federally or state-funded program behind it and specifically designed for Americans over 65 that is active right now and accepting applications. Most seniors receive none of them, not because they don't qualify, because nobody told them the program existed or showed them how to apply. That ends today. My name is Lucian Vane, and I've spent years tracking the federal and state benefit programs that exist specifically for older Americans, and studying why the people who need them most are almost always the last ones to find out they exist. The answer is always the same. The agency that runs the program doesn't have the budget to advertise it. The doctor's office doesn't mention it. The pharmacy doesn't bring it up. And the programs that help the most tend to be the ones nobody has heard of. What I'm covering today is real. Every program I'm going to name is active, funded, and available. Some require income verification. Some are age-based only. I'll tell you clearly for each one. Let's go through all 10. Number 1. Free prescription medications. This is the one with the most money at stake for the most people. And it's the one where the gap between what people pay and what they should pay is the largest. There are 3 separate programs that can get your prescription costs down to 0, and most seniors are using none of them. Program 1. Medicare Extra Help, also called the Low-Income Subsidy. Medicare Extra Help is a federal program administered by the Social Security Administration that pays most or all of your Medicare Part D prescription drug costs, premiums, deductibles, and copays for qualifying seniors. For 2025, a single person with income up to roughly $22,000 qualifies, a married couple up to roughly $30,000. And here's what most people don't know. If you already receive Medicaid, SSI, or Medicare Savings Program benefits, you are automatically enrolled in Extra Help. You don't need to apply separately. If you're not in one of those programs but your income is below those limits, applying for Extra Help can save you thousands of dollars a year in prescription costs. The application is at ssa.gov or by calling Social Security directly. Program 2. Pharmaceutical Manufacturer Patient Assistance Programs. Nearly every major pharmaceutical manufacturer has a patient assistance program, sometimes called a PAP, that provides brand-name medications at no cost to qualifying patients. These programs exist because the manufacturer would rather give the drug away than have a patient switch to a generic or stop taking it. The income limits vary by manufacturer, but most are more generous than Medicare Extra Help, some going up to 400% of the federal poverty level, which for a single person is over $58,000. The way to access these programs is through a nonprofit called NeedyMeds at needymeds.org, which maintains a searchable database of every patient assistance program for every drug. You type in your medication name and it shows you every program available for that drug and the eligibility requirements. Program 3. State Pharmaceutical Assistance Programs. More than 30 states have their own prescription drug assistance programs for seniors, separate from Medicare and separate from manufacturer programs, that either subsidize premiums, cover copays, or provide direct medication assistance. New Jersey's PAAD program, New York's EPIC program, Pennsylvania's PACE program, Connecticut's ConPACE, California's RX program. These are state-funded and specifically designed for seniors who fall in the gap between qualifying for full Medicaid and affording full drug costs. Action step. This week, search Medicare Extra Help and check your eligibility. Then go to needymeds.org and enter every prescription medication you take. Then search your state name plus prescription assistance seniors. Stack all 3. Your medication costs could drop to 0. Number 2. Free in-home care services. Most people assume that in-home care, having someone come to your home to help with daily tasks, health monitoring, or personal care, is an expensive private service you have to pay for out of pocket. For many seniors, it is available completely free. and there are two separate funding streams that can make it happen. Stream 1. Medicare Home Health Benefits. Medicare Part A and Part B cover home health services at no cost to you, no copay, no deductible, if you meet specific criteria. You must be homebound, meaning leaving home requires considerable effort. A doctor must certify that you need skilled care, skilled nursing, physical therapy, occupational therapy, or speech therapy, and you must be receiving that skilled care as part of a plan from a Medicare-certified home health agency. Under that plan, Medicare also covers home health aid services, someone who helps with bathing, dressing, and personal care, as long as you're also receiving skilled care. The key word is also. The home health aid visits are covered as long as the skilled care visits are also happening. This is the piece most seniors and even most doctors don't realize. Action step. If you or someone you love is homebound and has any ongoing health condition requiring monitoring or therapy, ask your doctor specifically, do I qualify for Medicare home health services? The doctor's order is the trigger. Without it, nothing happens. Stream 2. Medicaid Home and Community-Based Services. If you qualify for Medicaid, every state offers what are called Home and Community-Based Services Waiver Programs, HCBS waivers, that fund in-home personal care, homemaker services, adult day programs, and respite care specifically to help seniors stay in their homes instead of moving to a nursing facility. These programs cover things Medicare doesn't: help with cooking, cleaning, laundry, errands, and companionship, funded entirely by Medicaid. The income and asset limits vary by state, and in many states there are waiting lists. But if you qualify, the services are free, and the application starts with your state's Medicaid office. Number 3. Free legal help. Legal fees are one of the biggest barriers seniors face when it comes to protecting their rights. Whether it's drafting a will, fighting a benefits denial, dealing with a predatory landlord, navigating a Medicare dispute, or protecting against financial exploitation. Most seniors assume that if they can't afford a private attorney, they simply can't get help. That is not true. Program 1. Legal Services Corporation. Funded legal aid. The Legal Services Corporation is a federally funded nonprofit that has been providing free civil legal assistance to low-income Americans since 1974. Every state has LSC-funded legal aid organizations, and seniors are a priority population. They handle housing disputes, eviction defense, benefits denials, consumer fraud, and family law matters. If your income is at or below 125% of the federal poverty level, about $18,000 for a single person, you almost certainly qualify for free representation. Program 2. State and Area Agency on Aging Legal Assistance. Under the Older Americans Act, every county in the country has an Area Agency on Aging, or AAA, that is federally funded to provide services including free legal assistance to seniors 60 and older. Unlike legal aid organizations, many AAA legal programs do not have income limits. They are age-based, 60 or older, and they provide free consultations, document preparation, and referrals for issues including wills, powers of attorney, advance directives, Medicare appeals, Social Security disputes, and elder financial exploitation. To find your local AAA, go to eldercare.acl.gov or call 1-800-677-1116. This is one of the most underused resources for seniors in the entire country. Program 3. Law School Elder Law Clinics. Nearly every law school in America operates a clinic where supervised law students provide free legal services to community members. And elder law clinics specifically serve seniors with estate planning, benefits access, and protective legal documents. A law school elder law clinic can draft your will, your power of attorney, your healthcare directive, all free, under the supervision of a licensed attorney. Number 4. Free dental, vision, and hearing care. This is the one that generates the most disbelief, because most seniors know that original Medicare does not cover routine dental, vision, or hearing. And they're right, it doesn't. But there are multiple programs that do, and most seniors have never heard of a single one. Dental care. Dental schools across the country provide free or dramatically reduced cost dental care performed by supervised dental students. The quality is high, every procedure is reviewed by a licensed dentist, and the cost is either zero or a fraction of private practice rates. The National Foundation for Dentistry for the Handicapped runs a program called Donated Dental Services, DDS, that connects seniors and people with disabilities to volunteer dentists who provide comprehensive dental treatment at no charge. To apply, go to ddsprogram.org. Community health centers, federally qualified health centers, are required to provide care regardless of ability to pay, and many offer dental services on a sliding scale that goes down to zero for low-income seniors. Vision care, eye care. America is a program run by the American Academy of Ophthalmology that provides free eye exams and up to 1 year of care to seniors 65 and older who haven't seen an ophthalmologist in 3 or more years and who don't have access to an eye doctor through an HMO. The program matches you with a volunteer ophthalmologist in your area. To apply, go to aao.org/iCarryAmerica. Hearing care. The Starkey Hearing Foundation and the Lions Club International both run programs that provide free hearing aids and hearing evaluations to qualifying seniors. Audiologists across the country participate in these programs and provide donated or deeply subsidized hearing devices. Additionally, many state vocational rehabilitation programs cover hearing aids for seniors who need them to remain employed or independent, regardless of age. Number 5. Free home repair programs. A leaking roof, a broken furnace, a bathroom that's no longer safe to use, steps that have become a fall hazard. For a senior on a fixed income, any one of these can be a crisis, because the repair cost can be thousands of dollars that simply isn't there. What most seniors don't know is that there are multiple federal and state programs that will pay for these repairs entirely, at no cost to the homeowner. Program 1. USDA Section 504 Home Repair Program. The USDA's Section 504 Home Repair Program provides grants of up to $10,000 to homeowners 62 and older, with very low incomes to remove health and safety hazards from their homes. These are grants, not loans. You never pay them back. For larger repairs, the program also offers low-interest loans up to $40,000. And the combination of a grant and a loan can cover up to $50,000 in repairs. The income limit for the grant is at or below 50% of the area median income, which in many rural and suburban areas is roughly $30,000 to $40,000 for a single person. To apply, contact your local USDA Rural Development Office. The application is at rd.usda.gov. Program 2. HUD Community Development Block Grants. Local Home Repair Programs. HUD distributes community development block grant funding to cities and counties across the country, and many of those localities use that funding to run local home repair and rehabilitation programs for low-income homeowners, with seniors as a priority population. These programs vary enormously by city and county. Some offer grants, some offer zero-interest loans, some do the repairs directly through volunteer labor. But they exist in most urban and suburban areas, and most seniors have never called their city housing department to ask about them. Action step. Call your city or county housing department, not the federal government, your local government, and ask, do you have a home repair or rehabilitation program for senior homeowners? In most areas, the answer is yes. Number 6. Free food programs. Most people know about SNAP, the Supplemental Nutrition Assistance Program, formerly called food stamps. But there are at least 3 additional food programs specifically for seniors that most eligible people never use. Program 1. The Senior Farmers Market Nutrition Program. The USDA's Senior Farmers Market Nutrition Program provides low-income seniors with coupons, typically $20 to $50 per season. That can be used at farmers markets, roadside stands, and community-supported agriculture programs to buy fresh fruits, vegetables, herbs, and honey. The program runs seasonally and is administered at the state level. To find out if your state participates and how to apply, search Senior Farmers Market Nutrition Program plus your state name. Program 2. Commodity Supplemental Food Program, CSFP. The Commodity Supplemental Food Program provides a monthly package of nutritious USDA foods to low-income seniors, 60 and older. The package typically includes canned fruits and vegetables, canned meat or fish, cereal, juice, pasta, and dry or canned beans. The income limit is at or below 130% of the federal poverty level, about $19,000 for a single person. To apply, find your local CSFP site by searching Commodity Supplemental Food Program plus your county name. Program 3. Meals on Wheels and Congregate Meal Programs. Funded under the Older Americans Act, Meals on Wheels delivers free or low-cost hot meals directly to homebound seniors who cannot easily prepare their own food. The program is available in virtually every county in the country. Congregate meal programs, held at senior centers, churches, and community centers, provide free hot meals in a group setting for seniors 60 and older, regardless of income. To find both programs in your area, go to eldercare.acl.gov or call 1-800-677-1116. Number 7. Free medical transportation. Missing a doctor's appointment because you can't get there is one of the most common and most preventable health problems for older Americans. And most seniors who face this problem have no idea that free transportation to medical appointments is a covered benefit in their existing programs. Medicaid non-emergency medical transportation. If you receive Medicaid non-emergency medical transportation, rides to and from covered medical appointments is a mandatory benefit that every state Medicaid program must provide. That means if you have Medicaid and you need a ride to a doctor, a pharmacy, a dialysis center, or any other covered medical provider, Medicaid pays for it. The way to access it varies by state. In most states, you call a number on the back of your Medicaid card at least 48 to 72 hours before your appointment. Some states use a single transportation broker. Some use local providers. Medicare Advantage transportation benefits. If you're enrolled in a Medicare Advantage plan rather than original Medicare, most plans now include transportation benefits for medical appointments as a supplemental benefit. The number of rides per year and the coverage area varies by plan. Call your Medicare Advantage plan and ask specifically, does my plan include transportation benefits for medical appointments, and how do I schedule a ride? Area Agency on Aging Transportation Programs. Even if you don't have Medicaid or Medicare Advantage, your local area agency on aging may operate or coordinate free or subsidized transportation for seniors to medical appointments, grocery stores, and other essential destinations. Call 1-800-677-1116 to find your local AAA. Number 8. Free financial counseling. Debt, credit problems, mortgage issues, budget crises, predatory lending. These are financial situations that affect millions of seniors, and that a qualified counselor can help resolve at no cost. HUD-approved housing counselors. If you're facing a mortgage problem, falling behind on payments, at risk of foreclosure, or trying to understand a reverse mortgage, HUD-approved housing counselors provide free counseling at no cost. To find one, go to hud.gov/housing counseling or call 1-800-569-4287, NFCC member agencies. The National Foundation for Credit Counseling, NFCC, is a non-profit network of credit counseling agencies that provide free or low-cost financial counseling to anyone who needs it. Sessions cover budgeting, debt management, and financial planning. To find an agency near you, go to nfcc.org. Benefits Checkup. If you're not sure which benefits you qualify for, across all federal and state programs, the National Council on Aging runs a free online tool called Benefits Checkup at benefitscheckup.org. You enter your basic information and it identifies every program you may qualify for, including everything covered in this video, in one place. Number 9. Free tax preparation. Every year, millions of seniors pay between $150 and $400 for professional tax preparation, or file incorrectly on their own, and miss deductions and credits worth far more than the prep fee. There are 2 federally funded programs that provide free, certified tax preparation specifically for seniors, and most people who qualify have never used them. VITA, Volunteer Income Tax Assistance. VITA is an IRS program that provides free tax preparation by IRS-certified volunteers for taxpayers who generally earn $67,000 or less. VITA sites are located at libraries, community centers, and senior centers across the country and are open from January through April. AARP Tax Aid. AARP Tax Aid is specifically designed for seniors and is available to anyone 50 and older at no cost, regardless of income. AARP Tax Aid volunteers are trained and certified by the IRS, and the program operates at thousands of locations nationally. To find a VITA or AARP Tax Aid site near you, go to irs.gov/VITA or aarp.org/taxaid. Number 10. Free emergency alert and personal safety systems. Medical alert systems, the kind that let you press a button to call for help if you fall or have a medical emergency, typically cost $25 to $50 a month. For many seniors on fixed incomes, that monthly cost is a barrier. What most people don't know is that several programs cover these devices at no cost. Medicaid waiver programs in most states cover personal emergency response systems as part of home and community-based services. If you receive Medicaid HCBS waiver services, ask your case manager specifically whether a personal emergency response system is covered under your plan. Many area agencies on aging also provide free or subsidized medical alert devices through local programs, funded by the Older Americans Act. Call 1-800-677-1116 to ask what's available in your area. Some states also have their own senior safety programs that distribute alert devices free of charge. Search your state-free medical alert system seniors to find state-specific programs. Here is your complete list. 1. Prescriptions. Go to needymeds.org this week and enter every medication you take. 2. In-home care. Call your doctor and ask if you qualify for Medicare home health services. 3. Legal help. Call 1-800-677-1116 or go to eldercare.acl.gov to find free legal assistance near you. 4. Dental, vision, and hearing. Go to ddsprogram.org for free dental care and aao.org/iCarryAmerica for free eye exams. 5. Home repairs. Go to rd.usda.gov for the USDA Section 504 program and call your city housing department. 6. Food. Search for CSFP and senior farmers market programs in your county and call 1-800-677-1116 for Meals on Wheels. 7. Transportation. Call the number on the back of your Medicaid card and ask about non-emergency medical transportation. 8. Financial counseling. Go to benefitscheckup.org first. It will show you every program you qualify for in one place. 9. Tax preparation. Find a free VITA or AARP tax aid site at irs.gov/VITA before you pay anyone to do your taxes. 10. Emergency alert. Ask your Medicaid case manager or call your local area agency on aging. Every program on this list exists because Americans, people like you, paid into this system their entire working lives. Claiming these benefits is not charity. It is not a handout. It is your money, your programs, your rights. The only reason most seniors don't use them is that nobody sat down and explained what they are and how to apply. That's what this channel is here to do, every single week. If this video helped you, hit subscribe. And share this with every senior you know who is paying out of pocket for something on this list. One share could change someone's entire financial situation. I'll see you in the next one.